In the world, y'all check it. From mothers broken hearted, I surely came. Sons that were slain for minimal gain. Youth that can't read, speech that can't talk. Passion to move, but love that won't walk. I speak to you, my heart and my soul. My family and folks were I should.
Hello, and welcome to a new edition of Education is the Best Medicine. And thanks for watching. Remember, community public access is your best bet. Watch it whenever you can, and please support us in your local stations. Today is a show on mental health and access to mental health. In Alameda County, about 8.9 adults experience some sort of psychological stress. Women were just as likely to require services as men. We find that in overall services, healthcare in regards to mental health services is the last thing on the list. It's under, in our community, underdiagnosed, underevaluated, undertreated. We have a number of folks that have multiple mental health disorders that are going untreated, particularly if being incarcerated or homeless or underserved and undervalued. We have two gentlemen today, Mr. Jermaine R. Marsh, and Dr. Penn. I want to thank them both for coming on. They're involved in a program, 10 by 10.
Yes.
Which is, I'm going to let them explain about it and tell us a little bit about how we can provide and access better healthcare services in the community. So thank you for coming on. I appreciate it. Jermaine, tell us a little bit about your position in the program, and what do you think are some one of the things in terms of access to mental health, particularly in the African American community, you want to get out there?
I was going to say in the African American community, it's not a lot of education. I say it's a lot of stigma around like mental health and being dual diagnosed. Having a mental challenge and drugs and alcohol. I can say from like my own experience. I mean, I say from my own experience, I spend 10 years of my life incarcerated. I mean, from having an issue, I got out the service, and it's like I didn't want to be on like SSI was labeled, like manic depressive, and it was like these doctors wanted to have me on medication and pills, and they told me, you're going to be on this stuff, but I knew in my heart, I always excelled at everything I did, so it's like I wanted more out of my life, and I didn't want to be on, I didn't want to be on medication because I didn't like how it made me feel, and from there, I started my own process, by seeking, reading books and my spirituality, and I say from doing that, I wanted to know more. So eventually, I say from all the experience I went through by lack of knowledge and not wanting to even tell people in my family, because even in the black community, it's a stigma. My family was like, if they told me, hey, you're crazy, you're nut, we don't want to talk to you,
And so, Doc, stigma, and your involvement in the 10 by 10 program, and a little bit about your bio, and how do two guys like you hook up to have a discussion on mental health in the community?
Sure. Native to the Bay, born and raised San Francisco, live in Oakland now. I've been doing health advocacy work for the past 6 years, and so I've just recently connected with the Alameda County 10 by 10 wellness campaign. And so my capacity there is that they're media liaison, again, to increase the awareness of this campaign. And just this campaign itself, just to define it, the 10 by 10 stands for increasing the life expectancy of those suffering from mental health and substance abuse, increasing their life expectancy in 10 years by 10 years. So we're all about promoting life. And so again, we're great.
So the opposite of that is they don't get help. Their life is cut short by 20 years, maybe. Is that correct?
Exactly. With those who do have mental health and substance abuse issues, there is a definite lower life expectancy, and they're also and they die a lot from preventable diseases, chronic diseases, diabetes, heart disease. So again, this campaign is to bring the awareness of the whole person, not just the mental condition or the mental focus. So and that's why it's a wellness campaign. There are 8 dimensions that we go over, and so with again stigma. awareness. It's a lot of dispelling the myths out there, changing terminology. I mean, I just being on this campaign, I'm learning more terminology out there about just having a history of mental health. It's lived experience.
Yeah.
That's what it is, and I think that's so empowering, and that's what brings us together. You know, I'm just advocating the program, making sure awareness is out there. And my man gives the best testimony to make sure that awareness is brought to the appropriate audiences.
So part of our discussion here is more of a community call to be aware that this is one of the programs that is being rolled out by Alameda County Public Health to address some of the healthcare access and healthcare disparity issues in regards to mental health, not just in the African American community, but in the community in general, because it is an underserved issue.
Exactly.
What do you see? Jermaine, your discussion is real interesting because it sounds like you have a post-war background where you were in the military and got issues around trauma. Is it because again I'm thinking post-traumatic stress disorder, I'm thinking trauma issues, and I like to be clear, but that's not necessarily the case. Being in the military can be a traumatic experience.
I say it started even before before I went to the military. I mean, it wasn't even my mother suffered from bipolar, so it was in my family, and a lot of issues and stuff were either not talked about, I'll say it started from even at an early age. I had family members that suffered from drinking. They had issues, they had challenges.
So what we're seeing in our community, I mean, if I'm wrong, is we used to think that the substance abuse came before the mental disorder. Now some are saying not only with the component of genetics is that the mental disorder comes before the substance abuse disorder, and usually the use of substances, alcohol, tobacco, crack, methamphetamine, heroin, ecstasy are really self-medicating.
Yeah, I would say even for people that's suffering from mental health issues and stuff like that. I said it started with trauma. I said mine started with with abuse. I mean physical abuse. I started from being getting jumped at school to joining gangs to physical abuse. From my father. Being an African American male. My dad was angry a lot of times because he worked a lot and he couldn't be around his family. So I seen what he went through with my mother and stuff. He didn't beat my mother, but I seen how he told me how society treated him. He had to work certain jobs to take care of 5 children. I seen what he went through, like my father. So he was a lot of times angry. He was more than he was angry a lot. So he worked a lot, so my anger, my issues, and my challenge came when my father worked a lot, and eventually it led me to the streets, and so I became angry, and I hold in a lot of anger for a lot, I say half my life. I'm in my late almost 40s now. So it's like I hold in a lot of anger, and it was like I was a walking time bomb. I had to be incarcerated. I had to go through, not knowing that, I did have a mental issue I went to a doctor, and the doctor told me I was severely depressed and I was going to be on SSI for the rest of my life. And that's when I said I wasn't going to do it. And I tried suicide 2 times. I say, I tried suicide 2 times in my life because, it's like I didn't love myself. It's like I was looking for answers, but every time I went to a doctor, I even had a psychiatrist go to my mother and tell all the information that I told, so I had distrust with the system.
A little more about suicide. It's more common in men and women for all age groups, particularly in Alameda County.
Wow.
We have elderly men, the highest risk group for suicide. Now, and the reason why I bring it up is in my training, Dr. Pelham Joe, that we used to think that bringing up suicide would prone that client to go on to commit suicide. In reality, probably is a call for help that we haven't really been hearing. I don't know whether that was your training. My training was that, it's like, well, don't talk about suicide. And all of a sudden, there became a discussion about why weren't we talking about it? And why weren't we talking about it, Doc?
Yeah. Again, it's interesting as we spoke about stigma. There's even stigma, within medical education for yourself and mine. I can't say that in my medical training that that conversations of suicide should just be touched upon. That wasn't a part of my training. But again, particularly now with medications that talk about side effects, being suicidal thoughts or behavior. The discussions need to be had.
And I think from a historical standpoint, how do you address the mental health of a community that has been since it's being brought here against its will since the late 1600s, how can we not talk about that level of trauma that has been generational to where we're seeing, homicides and suicides dominate our young men because, again, they don't feel life is worth it. They think their life is over at 25. And our mental health or lack thereof of mental health has played a significant role in family relationships, in our economic strength, growth, and in terms of how we function. So, I always like to put that in the context of not just the individual, but a system that it impacts upon an individual. And again, I want to thank you guys for coming on and talking about a subject that we tend not to want to share, particularly as men of color. What got you to talking about it? What got you to have a more open approach to a behavioral health challenge?
I say what got me into wanted to get into behavior and learn about myself. I say it came, like I told you, it came from my childhood. It went from being on psych medication to knowing that life offered me more. So it's like I did the studying and I applied. I applied for a job through the county. And I say through my spirituality being like religious scientist, I studied, I wanted to know what was going on with my mind. So I did all the study, and then it's like I applied for a job. I waited 2 years to apply for like a job with the county of Alameda. And once I did, I started learning things as I became a member of the Pool of Consumer Champion. I became a member of the Best Now program. I started learning things about myself, and I studied. I remember some of the stuff that I was learning with the county was tangible to my spirituality. So it's like I took it in and I started working on myself. It's like I was reading. I was being around people like myself that were consumers. I don't like really saying consumers, but partners. I was around people that needed help but didn't know how to need help, and I became a voice. I talked on my own experiences. I advocated. I told about my recovery, how I went through change. I went through like 10 years of my life, like struggling, not having nobody to talk to. But I went to people, like-minded people who helped me, who suffer from the same conditions that it was older guys, like we say in the neighborhood, OGs. People told me about mental issues. They didn't tell me a lot. They told me to keep it quiet, but through those elders who I knew that helped me, it's like I started to, recover. I started getting well. I say my spirituality. I started studying, and it's like I wanted to help others because I seen in my community how people with mental issues, men and women of African American, were like put down, and it's like a taboo. You keep it in
trauma.
Yeah.
So I think also what is important is that. The things ring out in your conversation to me is that education is really key.
Yes.
Educating yourself at your level and the understanding and the expectation that healthcare systems like either Alameda County Public Health or any of the major healthcare systems need to have a collaborative effort with the people they're trying to serve.
Yes.
And to involve not only in how to service them, but also speak to them in the language that they understand.
And that's exactly what the 10 by 10 wellness campaign is about. Making sure that the services that are provided for mental health are extensive, are effective, and also, again, comprehensive. That's why it's a wellness approach. And I had alluded to earlier that there were 8 dimensions to wellness. And Brother Jermaine really spoke and alluded to those as well, in that spirituality is one of the dimensions. There's social, there's environmental, the people you have around, support networks.
Self-responsibility.
Jobs, occupational, just all those play in part in not only recovery, but just personal empowerment, personal
wellness of being in life.
There it is. Exactly.
Having a voice and feeling worthy. That you can accomplish. You accomplish your own goals in society by getting a job, having a home, working, and being able to talk to others and have group support groups. Where people help one another.
And I don't usually blow horns, but I really have to commend the present administration of Alameda County Board of Supervisors, in particular, folks like Keith Carson and Nate Miley, in regards to the Alameda County Public Health Leadership. The CEO, Wright Lassiter, have brought a no-nonsense direction. First of all, they've cleaned the facility up and rated as one of the major facilities, and now they're starting a collaborative effort with the community. There's an excellent list for those that are interested in terms of documentation in regards to homeless, underserved mental health issues that is published by Alameda County's Public Health Department. It's an excellent source of documentation, whether it's talking about the health of the community or particular aspects of that community's health, either food, safety issues, or mental health issues. So it's a real rich reservoir of well-published data on some of the healthcare issues, particularly in terms of mental health, our utilization of the ER, our under treatment, and the dominant issues around men that are not men, single men without children who primarily access the healthcare system through the emergency room.
Right.
Yeah.
You know, you mentioned support from a lot of the supervisors, and particularly Keith Carson. When I was sharing about the 10 by 10 campaign, it was initially kicked off last year, the end of last year, on October 10th, so 10/10/2011, and we had gone to the Board of Supervisors meeting. There was a declaration proclamation that was made, and so also I think December of that year was named the official kickoff of the 10 by 10 campaign. So there's Board of Supervisors support. We had shared information, had some other testimonials there as well. So it's
major stakeholders and
exactly.
That wanted to involve themselves in the campaign project.
So it kicked off with a bang. Since the year has started, we've had 2 events that have been sponsored by the 10 by 10 Wellness Campaign of Alameda County. The very first was a WRAP conference, and the WRAP is actually WRAP, and that stands for Wellness Recovery Action Plan, and that was started by a woman, Dr. Mary Ellen Copeland. And so this event had workshops and folks giving testimonials, and I believe there's some specific components about the WRAP program. Jermaine, can you share with folks about that a little bit?
WRAP gives you principles on daily maintenance of like your even your behavior. Like getting up in the morning, how you say having a daily maintenance, taking a shower. How you say reading
for the day.
Yeah, getting ready for the day, reading books. How you say looking for a job, knowing your triggers, and how do you what feelings you have, and how to empower yourself to stay healthy by getting the help you need, getting a case manager, being around people who want to help you, by how you say empowerment, of how you say of people, in the community that are supporting, counselors and people like that, and taking daily, like you say, your daily maintenance of how you really feel in the inside, and knowing that you have tools to apply, so you won't go over the edge or the ledge, knowing that you do have choices in your life, knowing that you can have resiliency, whatever you're going through, that you can get past that and be integrated to help yourself, by knowing that there's people out there who have suffered from mental, I don't like saying it, but mental issues or challenges, who have shown that just because you have a mental challenge that does not define you, and that how you say you're just going through how you say maybe trauma from your environment, trauma from how you say abuse, or trauma from how you say from life. Yeah, that's what I can say. And knowing that you can get better, and that life will change. By getting help.
Yeah, and the WRAP program, like I said, is one of the great programs that is a part, again, that's part of the 10 by 10 Wellness Campaign that we're promoting. It's a great program, as we see how the benefit that it has. So that event took place on May 1st, or that WRAP conference. It took place at Cal State East Bay. And so our second event, which just passed, was May 18th. There was our 10 by 10 Walk and Move for Health. It was a walk around Lake Merritt. And again, bring awareness of the 10 by 10 Wellness Campaign. We had a number of vendors representing health services. There was a suicide hotline. There was Family Education Resource Center. There's an organization called Peers. We also had a free farmers market. There was chair yoga, tai chi, and then again,
people showed up.
about 500 people.
Yeah.
Exactly. It was a great turnout, and we had different walks. We had one in the morning, one in the afternoon, and we even had a rock wall. I think my man Jermaine climbed that bad boy a couple times.
So get your walking shoes on.
Exactly.
Next year we're going to continue to run this. We want to start out as a campaign on this show. Although this event is past, we want to ensure folks that it will be an ongoing piece, and we want folks to get a hold of the 10 by 10 project, because there are a lot more things that will be happening. We're flashing it on the screen now, and we're flashing the contact information to get involved and to get some of this work to make it happen. You mentioned a couple of risk groups that are really prominent in behavioral health issues, particularly depression, schizophrenia, bipolar, anxiety, PTSD, and that population are ex-offenders, and those are incarcerated. 25% of individuals are incarcerated due to mental health issues. So our prisons have now become our major repositories for mental health issues. With this new issue around realignment and this move to move more of our clients back into the community with behavioral health issues, it's clear that we're missing areas to impact upon getting these folks into services. That's at intake, that's at incarceration, that's at any of the reentry programs. So there's a lot of arenas in which we can impact, and we want people to be aware that you got to get help, you've got to get evaluated, you've got to get treated, you've got to ask for services, and because it's very important that not only we ask for services, but that they be available. And this is a part of this collaborative effort to get that message out.
Indeed, one of the great initiatives, again, associated with the 10 by 10 campaign is it's another acronym. It's called PATH, and it's Promoting Access to Health. And so it's a whole effort to make sure that there's stronger pathways for folks who need mental health services. Also making sure that there's connections between physical health, medical health services and mental health services, and making sure those bonds are strong. Yeah. So that PATH program is very much promoted.
So it sounds as though that these kind of programs are now putting our clients at the center, and we're looking at a level of care for them that approaches not only their physical and mental, but their spiritual needs. This kind of approach is kind of new to medicine, I think, and kind of new to providers that are trying to discuss this issue. What would you say about people's resistance to this new kind of move?
I would say that just the community, the public, definitely our nation is becoming much more open to alternative means of therapy or treatment, or just expanded awareness of how to address mental health. And again, that mental health is associated with, again, all these many dimensions of oneself. And so I think that folks in general are becoming a little more informed and curious also about other approaches that can be had. So I think when other healthcare professionals enter into a treatment arena, or looking for other modes to treat a person or a patient, that I think they're getting more of an impetus from their patients, from the community, to look at other means to address the patient. And again, all brings back to why this 10 by 10 wellness campaign is to address the entire person. We want to get rid of stigmas. We want to make sure that person is valued, feels valued themselves, and again, it all brings it back to empowerment.
Jermaine?
Yes. What I was going to say about the 10 by 10 wellness campaign, I feel it's a great empowerment, movement for people who are consumers who have went through the mental hospitals and things. I believe the 10 by 10 wellness campaign is a positive and beneficial plan, I would say, in Alameda County to reform people who have went through, like you say, mental issues, because I said everything about it. Because I went to it, and I participated in all the events, and they were very helpful, and it was holistic. I mean, it was a holistic approach. I say mind, body, and spirit, it freed a lot of, how you say, a lot of blockage, I say, and you did a lot of education, because everywhere you went, it was booths and it was people showing compassion and love, for people, and people didn't even notice what was wrong with people. All they seen that people were complete and perfect. They seen the good that was there in people, and people talked about their life stories, and even some people even cried, but it empowered others, to say, hey, I want to get more involved. How can I become even a volunteer to this? I heard people say that, and it was like, I seen people of all ages and diversity, and I even seen kids there, that they say, they were in high school, that they had suffered, and they wanted help. So I believe it's very beneficial. I think more awareness, I say, out there would be even better, awareness by, having people, like you say, even like we're on here talking about, I think we need more people to have voices in the community and educate people, because a lot of things that we don't know in our communities have held us back, from people getting help because of, like you say, because of doctors, or, I just say by betrayal, in the community, like if I talk about this, am I going to be ostracized from my family?
Yeah. Jermaine was speaking about having more conversations and how, with families, sometimes there can be ostracization, but I feel that as we bring more awareness, as particularly even just the walk that took place, it did a whole lot to reduce a lot of the stigma. I mean, there were kids there that, this is a mental health event, and kids are there, and so it's not like, only playing on the jungle gym and, don't pay attention to that. So families were open with that. All ages, again, of people were there.
Gentlemen, we got about 2 minutes. I'm going to allow both of you to have the final word, but I want to mention a little discussion by Alameda County, again, Health Forums. That said that the biggest concern by that community was the cost of health care, the fact that a large number of folks are uninsured, and accessibility. Final word?
I think when we think about access, folks need to have more conversations, and folks know where to go, and so I think ridding of stigmas, having more conversations, mental health, knowing that help is needed, and particularly 10 by 10, there's more pathways to healthcare services that I think folks can be directed in an appropriate way.
Jermaine?
I believe that's what I believe. I believe it right now. Like I say, Alameda County, I say in California has the best, like you say, education and coverage, for the county of Alameda. But I believe it needs to be like even spread out more, because like you say, a lot of people don't know that it's a lot of resources and service for people with mental health issues. And I believe by spreading the awareness and getting educated and having people to speak up, I would even say, like having, like advocacy and, showing people, hey, look, these people live in a real community. These are real life people like me and you. How you say, we may think something is wrong, but they're crying out for help, from the community, so, they can get educated and have people come here, I say, like people like Dr. Marcus here and myself, because I say, I'm an intern, and, I say from my own experiences, I want to get out there and help each other.
Well, thank you for coming on. Thank you for bringing light to a very dark world. African Americans about 3 times as likely need professional help. Asian Pacific Islanders also are underserved. I want to make sure that the 10 by 10 is a run toward our mental health and taking care of it. I want to thank you gentlemen both for coming.